First, we're going to be talking with a pediatrician. We have Irene on our show, who is a pediatrician. She works at, she actually started Champs Pediatric. It's a new clinic in Kihei at the Park Plaza. And they're also going to be opening one in Kahului, another location in Kahului. So we're super excited. She's an excellent local pediatrician, and we're going to be talking about the COVID-19 vaccine and whether or not you should consider getting it for your kids if they are 12 and up. So the first thing I want to ask you is, would you recommend that someone get the vaccine for their kids if they're 12 or older?
Yes. So for the Pfizer vaccine that's now emergently approved for 12 years of age and above, yes, I do. Once it's available to them, I recommend that they do it, as long as they always check in with their pediatrician first.
Awesome. And then is there any reason for your patients that would give you pause or make you think maybe this child or kids in this category shouldn't get vaccinated? Like, what are your thoughts on that?
So they have the same contraindications as the adults. So if they have a severe allergic reaction to the first dose, it's recommended that they don't do the second dose. And the only incidence where we have to consult with an infectious disease specialist is if the child has already had actually MISC, so the multisystem inflammatory syndrome in children. So they may have to wait about 90 days as of now. They may have to wait about 90 days to get that vaccination. And that, of course, is going to be consulting an infectious disease specialist. But all other cases, they can discuss with their pediatrician and get it. We know now, so I know a lot of parents have concerns. I'm a parent too. And I understand the concerns of doing anything, any intervention. As more adults are getting vaccinated in the US, so we have about 270 million, 268 million, I think, doses have been given right now. It's about 36% of the population in the US, and maybe even higher if we consider just adults, have been vaccinated. And it's been many weeks after that first dose. We have a great pool of evidence and information from that. What we know right now, and anything I will say today is information that's from the CDC or has been published in peer-reviewed journals. So what we do know is that the percentage of cases amongst the population, we're going to start seeing a change. So that age group 12 to 17 is going to start consisting of a higher percentage of positive cases in the US. So we know now they're at about 9% of the positive cases. If we compare them, this is what I tell to parents, because they all say it's not serious in children. If we compare the 5 to 11-year-olds when they get COVID to the 12 to 17-year-olds, 12 to 17-year-olds have a higher risk of hospitalization. And again, this is from studies. So they have a higher risk of getting severe COVID compared to the younger kids. The chance of mortality, it's not zero, so it's low. We know about 127 children in this age group, 12 to 17, died of COVID from January 2020 to April 21. It's a low number, but it's not zero. So I can't tell a parent that there's zero chance of your child having severe COVID-19, and that way you don't need the vaccine. So I do believe that it's better to be protected.
So, I mean, as a mom, if I'm trying to weigh the risk of my kid getting COVID versus getting vaccinated, and I know a lot of people are worried about it because it's a relatively new vaccine. Do you think they're about equal? Is it a lot riskier to get COVID than to take the vaccine? What are your thoughts on the risk? If I'm trying to weigh, the risk of getting vaccinated for my child versus if they catch COVID, like what could happen if they catch COVID versus what could happen if they catch the vaccine? Do we have any information on that?
So I always tell my families that anything we do in medicine has a risk and a benefit, anything. And we always weigh the benefit of the intervention with the risk involved. So first of all, let me answer about, because you said a new vaccine. The technology is not really new. So mRNA vaccines have been studied and are continuing to be studied, and they've been studied for more than 20 years and in many research centers in the US and abroad. So the technology was there. They've been studied for possible flu, for CMV vaccine, for Zika virus. So the technology was there. It's that they used it now for a coronavirus. Secondly, the efficacy of the vaccine. The study that came out of Pfizer showed that it protects, in this age group, 12 to 17, 100% from getting COVID-19. And that is an amazing number. So we didn't get that in the adult studies. The risks involved from the history of giving vaccines throughout whenever vaccines started, we know that the most serious adverse effects, and they do happen, I won't say that there's zero adverse effects with vaccines, but the most serious ones happen in the first 6 weeks after the vaccination. And that is why they needed 2 months to give that emergent approval. So for example, live viruses that are most common, sometimes they cause severe adverse reaction. They cause the illness, the live viruses. That happens within the first 6 weeks of vaccination. We know with this vaccine, after 268 million doses and 6 weeks have passed for the majority of those first vaccines, we don't have severe adverse reactions. The most common reactions in this age group, 12 to 17, was very high percentage of pain. Almost 90% of the vaccinated had topical pain in that arm that they got it. About 0.6% did have lymphadenopathy, so increased enlarged lymph nodes on the side of the arm that they did, which resolved. And then there was about 40% that they did have fever and headaches, and all of those resolved in 1 or 2 weeks. So again, we didn't see any severe adverse effects, meaning that something that would leave them with a permanent deficit for the rest of their life. While SARS-CoV-2 can cause a severe disease. So when you weigh those two together, I think it definitely goes towards doing the vaccine.
Awesome. And then just on top of that, I heard you say like some vaccines are live viruses, and I've heard people worrying about, is this going to give me COVID? Am I going to transmit COVID to others? So can you speak to that? Can people catch COVID from this vaccine?
No, there's no way to catch COVID. So it's not a live vaccine. Even the live vaccines like the MMR or varicella, they're live inactivated. But this one is messenger RNA. So this is a little particle that will go and enter, just like SARS-CoV-2 will enter your cells. This will enter the cell, and it is the code that some other organelles in our cell, some other organisms in our cell will use to transcribe that code. And they will use that to make the spike protein. It never enters the nucleus, so it doesn't affect our DNA. So it can't produce the whole virus. It can only produce a little piece of the virus. And that piece, that spike, is going to make our body think that we have the infection, and we're going to start making antibodies. And that mRNA afterwards is destroyed in our body. There is no way to get actual SARS-CoV-2. And that's why, with this theory in mind, it's considered safe for pregnant women because it cannot infect the embryo.
Awesome. And then I've also had some parents saying things and posting things on Facebook about concerns that might affect their kids' fertility. And I don't know where that idea is coming from or what is going on with that. I don't know if it's totally bogus. Do you have any idea what that is about or why people think that?
Yes. So there was, I don't remember exactly when it started, but there was I'm not sure if it was a physician, but there were some reports questioning if that mRNA, the code is similar to a code of one of the proteins of the placenta called syncytin 1. So they said, although that's very similar code, so if you're going to be making this spike protein and you're going to be making antibodies to it, maybe you're making antibodies to this other protein that is very similar and is in the placenta. And that, from many, many researchers all over the world, has been shown to be false. So there are no antibodies against the placenta. And now, after so many doses given to women, again, going back and saying that the most severe adverse effects happen in the first 6 weeks after the vaccination, we haven't seen an increase in infertility in the US. We haven't seen women not getting pregnant. Many women that got the vaccine afterwards got pregnant. So the numbers are just not showing that.
Okay, awesome. So as far as you know, there's no like reality to that. There's no evidence of that happening at all. And so people,
as of now, of the official report as per the CDC, no, there's no evidence to show something like that.
okay. And then would you recommend people get vaccinated before they like travel to the mainland? If they're leaving the state, are you going to be more prone to encourage them to vaccinate because of that, or does it matter? I mean, is there any reason why people should?
I generally, when they ask me, say, once it's available to you, and meaning that you qualify, get the vaccine, because it's irrelevant to travel or not.
Okay. And then one more thing I wanted to ask you before you go, and if you want to stay on, you can, or you can jump off afterwards. I just lost my train of thought. Sorry. I don't think I'm going to get it back. I know. With the variants, we're seeing more and more concern about the variants, and we're actually going to be talking with Lee a little bit about the variants after this. But are you thinking the variants are concerning as far as pediatrics go? Would that affect your recommendation of getting the vaccine with all these new variants? Does it increase your concern at all?
It wouldn't affect my response to getting vaccinated. Again, we want to be protected for multiple reasons in this age group. So I don't think there's any information specifically right now for this age group, the teenagers, as a difference when they're vaccinated with these variants. And nothing to have me say that do not get vaccinated or wait to get vaccinated. So I would still give the same recommendation. I would like to say that there's another part of this that some people may not think about or correlate, but during this pandemic, we've seen a huge increase in the mental health crisis in teenagers. So we see now the numbers say that 1 in 3 girls and 1 in 5 boys have reported a significant increase in depression and anxiety. And a big part of it obviously is being away from their peers. This age group is the most important age for them to start being a little bit more independent from their family, being closer to their peers, being in school, finding their own personalities, and they are missing out on all this. So if there's a safe vaccine that can get them in a room with other people without a mask, I would definitely tell them to get it.
We had one question from a Facebook viewer who is a supporter of our group about the vaccine and people with cystic fibrosis. So can you address the issue of is cystic fibrosis a contraindication for getting vaccinated, or are there special considerations, or what?
As of now, from the reports from the CDC, it's not a contraindication, cystic fibrosis on its own. I would especially say that people that do have underlying health conditions are higher risk. So I would even more importantly want them to be protected. Of course, they always have to check with their pediatrician, with their specialist, because each one may have some specific considerations. But in general, it's not right now a contraindication.
Yeah.
Thank you.
Awesome. Does anybody else have any other questions? I really do appreciate the point you brought up about kids and suffering from depression. I do feel like our kids need to be able to get back to some level of normal, and this is the key to making that happen. And schools are more likely to lift mask requirements and all of that if they know most of the kids are vaccinated. They're more likely to allow contact sports and all these kind of things that are a normal part of childhood if the kids are vaccinated and they know they're not putting them at risk. So that's a very good point. I appreciate that. Anything else you want to add, or anybody have any other questions?
I don't think I can hear the question.
Sorry.
Anna is saying you're great. Anna Mabot.
Okay.
Anyway, yeah.
Excellent.
She's saying I think she knows who you are.
I just wanted to make one point of clarification. When you said that kids with cystic fibrosis are at higher risk, you meant higher risk of contracting COVID, not higher risk from the vaccine. So I just wanted to clarify.
Higher risk of complications, of getting, ill.
Yep.
From COVID.
I don't know if they're higher risk for getting COVID, but in general, any underlying condition that would affect your respiratory system is a higher risk for getting any virus. So
Okay.
from that, not that they're high risk, no, of getting the vaccine. So it's not a contraindication right now, unless there's something else.
Okay, thank you.
If I could just
Are
clear
there
it all.
any, I know we've heard of adults having long COVID. Are we seeing that in children? Do children have long COVID? Are there longer term complications that have happened with COVID?
It's hard to say. There are some studies showing possibly long-term, like joint pain, headaches, but it's hard to give numbers because the actual numbers are probably higher than what we know, because kids get a mild disease and mild symptoms, or maybe no symptoms at all, and they never actually reach the point to require getting testing, or it seems that it's not zero though. It may, but I don't have exact numbers to give you.
That's okay. I just wanted to check because I know we talk about long COVID a lot with the adults, and I know Dr. Peng's been talking about that at the press conferences. So I just wanted to find out if that's something that kids have been suffering from. So I think we're done with this part. Unless anybody has any other questions, you can feel free to stay on. We're going to go over Hawaii state numbers and Maui County numbers, and then we're going to start talking about the latest updates with the variants. So thank you so much.
Thank you very much for having me. In case I just have to sign off.